Hi, this is Ann Hafner at Nurses PRN. This month we're talking about caring for a patient's family on our monthly video blog. Often we are so busy taking care of the patient that we do not notice, let alone nurture, the friends or family at the bedside. Yet it only takes a few minutes, and doing so benefits everyone involved. I have 10 tips that will help you care for the caregiver and the patient. Tip number 1, take their hand in yours, look them in the eye, and verbally acknowledge their pain. Too often our comments are made in haste. This small gesture shows them that you care about them too. Tip number 2, tell them you realize that they have entrusted you with their most valuable possession, their loved one, and assure them you will provide your absolute best possible care. Number 3, cultivate reciprocal feelings of trust. You for them and they for you. Show them you're on their side and will do everything you can to help make their stay a little better. Number 4, honor their knowledge of the patient and his or her condition. They know the patient best. Let them know you realize that. They will be much more receptive of your input when you have honored theirs. Tip number 5, alleviate their guilt. The family member frequently harbors unspoken feelings of blame about their loved one ending up in your facility. A few kind words can ease their burden. Tip number 6, tell them the truth. Gently and honestly, but always tell them the truth. Feeling fooled or ill-informed is one of their greatest worries. Tip number 7, remind them to care for themselves physically, mentally, and spiritually. Encourage them to eat regularly, visit the chapel, or walk in the garden. Provide uplifting, inspirational books to give them hope and healing. Give them permission to take time for themselves. Have them go home, take a shower, sleep. Remind them that they cannot care for their loved one if they are weak or sick. Tip number 8, be patient with their impatience. They are often guilt-ridden, exhausted, and worried beyond their ability to cope. Sometimes we have to remember we're so busy at work, but they just want answers about their family members. For example, if we send a lab in, the family wants the answers right away. They don't realize that you send their blood work into a lab that has to process it. You have to get those information to the doctor has to relay that to you before you can relay it back to the family. So if you explain some of the processes to the patient's family and the patient, the care will go much more smoothly. Tip number 9, connect them with your facility's social services department. Most have resources that offer support. And number 10, smile. Their facial expression will mirror yours. When you smile, they will, maybe for the first time that day. These 10 tips will benefit you, the patient, and the caregiver. You will save time as difficult family members can impede patient care. Your heart and feet will ache less. The patient will notice your compassionate understanding, which contributes to his or her healing and peace. And the caregiver will feel cared for, a much needed and long overdue reward. This is Ann Hafner from Nurses PRN. And remember, if you have any ideas for our monthly video blog, let your schedulers know and we will put them online. Have a wonderful month.